Hello, and welcome to the Center of Excellence presentation on medical issues in autism spectrum disorder. The medical issues training reviews common co-occurring conditions for children with autism spectrum disorder, or ASD, and how those issues may impact functioning and interventions. This training is intended for parents, caregivers, support staff, and interested members of the community. Please be aware this presentation is not intended to provide individualized diagnosis or treatment. The objectives for this training are to recognize common co-occurring medical issues, describe how each medical issue may impact an individual diagnosed with ASD, and to generate ideas that may improve care for an individual diagnosed with ASD who may have other medical problems. Here's a list of true or false questions related to medical issues with individuals with autism. These are true or false, and go ahead and read through, mark either in your mind or write down on a piece of paper your answers, and by the time we get through the presentation, we should all be able to clearly answer these questions correctly. I'll read through them quickly. Individuals with autism have common co-occurring medical conditions. True or false? Individuals with ASD often exhibit behaviors due to other medical issues. Medical issues are easy to identify in individuals with ASD. And the most common co-occurring medical conditions in ASD are sleep disorder, seizure, gastrointestinal issues, and overweight and obesity. So go ahead, take a minute, jot down your answers, and then we'll move along. Did you know there are a lot of misconceptions about autism? Historically, autism has been viewed as mostly a behavioral disorder, but recent research confirms there are many underlying medical conditions that frequently occur at higher rates in individuals with autism. Often behaviors associated or thought of as just part of autism may well actually be signs of these co-occurring medical conditions. The medical conditions often affect each other, and thus improvement in one area will often lead to improvements in other areas. Most importantly, by recognizing and treating common co-occurring medical conditions, individuals with autism will often improve behaviors and achieve other goals like improved ability to communicate, socialize, and learn. So important things to remember throughout this presentation is number one, autism spectrum disorder is not simply a behavioral disorder. There are medical conditions that frequently co-occur with ASD and which contribute to the overall health and behavior of the individual. So it's important that we just don't look at behavior for the sake of behavior. We really want to look and make sure we're potentially diagnosing any underlying medical issues. And often the co-occurring conditions will affect each other and impact each other. So if you improve in one area, you may improve in the other areas as well, and then see from those medical improvements changes in overall behavior. Let's be sure to keep in mind that medical issues in people with autism are frequently not recognized, especially if you're not dealing with medical professionals who are used to working with individuals with autism. The medical issues can cause significant discomfort and pain, can cause challenging behaviors, and may delay developmental progress. And the issues may be difficult to identify because the child may be difficult to examine or even impossible to examine physically. The child may have limited communication skill, and providers may fail to recognize those behavioral links to the underlying medical conditions. And behavior in autism tends to overshadow everything else. Most people who are working with individuals with autism focus in on behavior as opposed to really first looking at medically what could be going on underneath. Especially important to remember, and I can't emphasize this enough, is that children with limited communication skills often have behaviors related to these medical issues and must be evaluated in the absence of being able to communicate their feelings. What that means is essentially, especially kids who are nonverbal, we have to go with the assumption that there are underlying medical issues and disprove them before we can really just assume the nonverbal person is having behavior for the sake of behavior. That person is unable to communicate with us, pain, discomfort. So we want to make sure that they're evaluated completely from a medical standpoint to be sure that we can rule out any underlying medical issue. So when we're talking about medical issues, the big four that we're going to focus on, which tend to be the most common in individuals with autism, are GI issues and dysfunction, sleep disorder, seizure disorder, and overweight and obesity. And this diagram shows what we're going to highlight in the fact that these are all often interrelated. So you improve in one area and you can affect the other areas as well, and we'll get into how that's possible. So we're going to start the discussion with sleep disorder. And for any of you who work with children with autism, we all know this is an incredibly big issue. Children with autism show irregularities in sleep, often due to behavioral or sensory reasons. There can be biological contributors or medical problems. And just to give some examples of what those look like, it can be anxiety. Simple as that. Possibly there's a new staff that started in the house, or something happened during the day, or just generalized anxiety. New medications can affect sleep, changes to the schedule or the sleeping environment, GI upset or disorder, again, highlighting that interrelated component between GI and sleep. But things like bright lighting, noises, really anything similar to individuals who don't have autism who have difficulty sleeping. But things particular to a residential environment are things like bed checks, movement near bedrooms, a roommate who might be up and loud, or unfamiliar sounds, especially for someone who's new to their environment. So all of those can be reasons that you'll start to see sleep irregularity in kids. And children can present with different symptoms of sleep disorder. So they may have irregular sleep cycles, which means up during the night, sleeping during the day. There might be difficulty in settling down or being able to fall asleep. Their sleep duration, how long they sleep, might be short, or they wake up oftentimes at night. They could have inefficient sleep, which means not getting really into a deep sleep. And that's really important for the body in other areas as well. So that's a key contributor to the interrelatedness with the other areas that we'll talk about. And there can be sleep fragmentation. So due to incontinence care or other interruptions, as I mentioned before, bed checks can really enhance kind of fragmented sleep. And so there are a lot of reasons that we may see sleep disorder in kids. So some indirect signs that we'll see of disordered sleep are really negative impacts on attention, the ability to really focus and concentrate, as well as mood. So we might see some increased moodiness, again, can translate into behavior. And there'll be increases in things like irritability and anxiety, self-injurious behavior, any repetitive behaviors can increase. We can start to see weight gain, leading to overweight and obesity. We also can see signs of insulin resistance, which ultimately can lead to prediabetes or type 2 diabetes. But notice that the signs and symptoms listed above, which are associated with sleep disorder, are often attributed just to autism, as opposed to there being a distinct separate diagnosis of sleep disorder. So it's really important to ask when you see something like self-injurious behavior, is this just behavior, or is this actually related to the fact that the individual isn't sleeping? Because it's also a sign of that. So we really need to rule out the sleep disorder to get down to what actually is other significant behavior. So the primary sleep issues that we'll see associated, insomnia, which is really the inability to sleep. Again, comes in a variety of ways, but that is associated strongly with autism. Sleep disordered breathing, which is something like snoring or sleep apnea. Parasomnias, which is really undesirable physical or verbal behaviors. It's like walking or talking during sleep. And sleep-related movement disorders would be something like restless leg syndrome. And increased rates of sleep disorder with individuals who have anxiety and seizure disorder. So we see that relationship. Important to note is that the incidence of sleep disorder in the research is up around 71%. So the majority of individuals with autism have some type of sleep disorder, while the diagnosis is only 30%. That's a key takeaway from the sleep portion of this presentation, and that we're really very much underdiagnosing sleep disorder in this population. So there are many evidence-based practices to address sleep disorder. Things like daytime factors, what's done during the day, evening habits, bedtime routines, visual supports, sensory strategies. They're all well represented in the literature. Some examples would be providing, as simple as providing a dark, quiet room for sleep, keeping to a consistent bedtime routine, making sure there's plenty of time for exercise, although making sure it's not too close to bedtime, as it can actually increase difficulty in sleep, making sure we're not giving any caffeine, especially really anytime later than the morning time. Even in the afternoon, caffeine has been shown to affect sleep cycles. We want to make sure that kids aren't sleeping too much during the day, so making sure we're not letting them take afternoon naps late in the day, and maybe using a visual schedule to prepare your child for bedtime. So getting them used to a particular routine and an expectation of the steps it will take until there's bedtime. So now we'll move on to our second co-occurring medical issue, which is gastrointestinal issues. The research shows a wide range of prevalence for individuals with autism, anywhere from 9 to 70%. But most reviews are towards the upper end of that range, so up around the 70% mark. Individuals with autism are 4 times more likely to experience GI complaints, the research shows. 3 times more prone to experience things like constipation and diarrhea. So we can tell from that we're seeing the prevalence of this disorder way more in this population than we do in a neurotypical population. And in a comprehensive review of GI symptoms in children with autism versus children without, problem behaviors may actually be the primary or only symptoms of the underlying GI problem. So that's really important to notice, is that if we're looking at 70% or up to 70% of the autism population with an underlying GI disorder, and that behavior is actually an indication of that GI issue, then we really, again, need to make sure we're evaluating these individuals for those GI concerns. In a child who's nonverbal, especially if there's self-injurious behavior or aggression, GI dysfunction has to be ruled out as the source of those potential behaviors. We have to rule it out to make sure we're not missing something that an individual can't tell us through verbal means. Let's look at the indirect signs of GI dysfunction. So first we have that self-injurious behavior, especially hand biting, and biting in general on the hand or arm can be an indication of GI dysfunction. Also scratching of the face, aggression in and of itself, banging and punching on the chest, rocking or folding over a chair, which oftentimes, again, is something that we sort of think of as a typical behavior for someone with autism, may actually be an indication of GI dysfunction. Excessive salivation or drooling, and self-disimpaction, which can also be indicative of a GI disorder. Individuals with autism often have poor sensory localization, and what that means is that the behavior won't always correspond to the area of pain. So just because there's an issue with their stomach or their lower intestine, they may not be pointing to that area or hitting that area because of the pain there. Again, they may have something going on with their gastrointestinal tract, but they're biting on their hand. So you can't assume that a stomach ache, the person's going to be holding their stomach. It doesn't work that way, especially in autism. Individuals can't sometimes figure out where the pain is coming from. And so it makes sense that they're just having a behavior to kind of say, I don't feel right. I can't give you more than that, but we need to be paying attention to those signs that something may be wrong. Some common GI conditions that we see in individuals with autism can be as simple as something like abdominal pain. Constipation is incredibly common. You might also see things like bloating or chronic diarrhea. We might see an increase in GERD with individuals with autism. And the gastrointestinal issues increase with sleep disorder. So, again, there's that circular pattern that actually conditions can affect each other. So, what do we see? When somebody has sleep disorder, oftentimes the way that'll translate into a GI issue is we might see some slow transit times. We also can see that it will affect nutrient absorption, especially if the individual is never getting to that really deep sleep. That's oftentimes when the body is doing its best absorption, is doing that mode of sleep. We also can see an increase when somebody has an anxiety disorder. So we know when somebody has anxiety, their body is constantly kind of in that fight or flight mode. Well, fight or flight mode means that blood flow is really pushed to the extremities and away from things like digestion. So individuals may not be getting hunger cues. Digestion may not go well because we're not really getting adequate blood flow there because your body is mistakenly in kind of this chronic fight or flight. So we never engage what we call that parasympathetic nervous system that helps us calm down and digest. So next we're moving into seizure. And seizure is defined as a short disruption of electrical activity in the brain, sometimes lasting seconds, but may be longer than that. And seizure disorder, it starts in the brain, but the signs are really varied. And so with some individuals with seizure, it can become very familiar to us and very obvious. I think most people kind of imagine a grand mal seizure where somebody is very obviously having a seizure. But in autism, you can have individuals that have very small seizures that don't necessarily have those same sort of stereotypical symptoms. So just if you see an individual who's kind of staring off, that could be an indication of a seizure. Just a simple stiffening of muscles, involuntary jerking of limbs, maybe slight facial twitching, regression potentially in normal development can be a sign of seizure disorder. And then there are things like severe headaches, sleepiness, and that sleep disturbance. Again, we see that overlay. Aggression or irritability, we can see, and unexplained confusion, which can happen. All are signs of seizure. And again, reminder that some of those signs can be extremely subtle. But about 20 to 40% of individuals with autism also have a distinct seizure disorder. Important to note that seizure is more common in individuals with lower verbal ability. And individuals who have seizure disorder are more likely to also have sleep and behavior problems. So important to recognize that for our individuals that also have sleep disorder. And some of the brain abnormalities associated with autism, things like traumatic brain injury or congenital abnormalities, may also contribute to seizure. Seizure disorder, what do we do? So the first thing that we want to do is we want to note whether or not we're seeing some of these unexplained potential indications that something like seizures could be going on. We want to make sure that we get some intervention from a neurologist who can do a test called an electroencephalogram or an EEG, which essentially measures brain activity patterns, and it helps you to see if there's actually seizure activity present in the brain. Treatment most commonly will include medication, but it is possible to help treat seizures through dietary changes and even surgery if necessary. So our last medical comorbidity that we're going to review is overweight and obesity. The prevalence in children with autism is higher than in the neurotypical population, with obesity being roughly around 34%, so about 1 in 3. It's sometimes associated with medication use, especially the psychotropics, which can cause weight gain in this population. And children with autism, the research shows, have a 5-fold increase in problem feeding and eating compared to children without autism. So that means we see kids with even restrictive eating or a very limited variety actually can contribute to an overweight and obese status. So the nutritional issues that we'll see with individuals in autism, we see a very high intake of processed foods. And that intake can vary depending on sensory issues often. So kids who are hypersensory, they oftentimes will want foods that are very bland in nature. So that beige diet, so things that are like French fries and pasta and rice and chicken nuggets. So very kind of flat flavor profiles. Kids who are hyposensory or need more sensory input will often like processed foods at the opposite end of the spectrum. So things like spicy Doritos or condiments on foods like Tabasco, that really hyper palatable food. Other issues are, of course, that restricted intake. So limited variety and restricted intake, especially in the micronutrient category, which is fresh fruits and vegetables. We see that food is used oftentimes as a behavior modifier or as a reward. That's an issue with individuals with autism and should not be done. Food is just food. It should never be associated with behavior. We also will see more commonly in individuals with autism nutritional deficiencies, especially protein, calcium, vitamin D, the B vitamins 6 and 12, as well as iron. And that increased food aversion and selectivity is a really important component that needs to be addressed in order to really get a healthy overall diet. Overweight and obesity increases with other medical comorbidities. So again, things like anxiety. So we'll see some stress or emotional eating. We see limited hunger signals and satiety signals, which I mentioned before, the lack of engagement of the parasympathetic nervous system and the real fight or flight that anxiety brings with it. Sleep disorder, I think we mentioned this before, there'll be decreased nutrient absorption and an increased risk of insulin resistance and type 2 diabetes. So there are many evidence-based practices to address overweight and obesity. Not necessarily even specifically to the autism population, just in general. We want to make sure we're choosing whole foods or lightly processed foods. And whole foods are really foods where nothing's been added, nothing's been taken away. So fruits and vegetables, whole grains, meats, those are all healthy whole foods for an individual that will help to give all of the nutrients that are needed, but not anything that isn't needed or could be problematic. Lightly processed foods are exactly that. They're essentially foods that are processed, but we can recognize all of the ingredients and we're sure that what we're eating is actually food, nothing artificial. We want to make sure individuals limit sugar and refined flour. This is extremely important if we see an individual who has a risk, a family history, or is showing signs of prediabetes. We want to make sure that we increase the intake of protein foods. Those are things like meats and fish and nuts and beans, and also fiber, which again comes in the form of those fresh fruits and vegetables and whole grains. We want to make small changes to familiar foods. So we know in this population that big changes, especially when it comes to eating, can be very scary and increase anxiety, which works against us having a successful mealtime. So making slight changes to foods is often very successful. We want to make sure, especially, that we work on acceptance of a variety of vegetables. Many individuals with autism will simply turn away any food that's green, and so, or has any kind of vibrant color that they're not used to. And so we want to make sure, because vegetables really hold the key to micronutrients and an overall healthy diet and tend to be so averted in autism, we want to make sure that there is a focus on starting to increase the acceptance of vegetables. And sometimes that needs to occur away from the table. So things like gardening and grocery shopping are both places where you don't really tend to be eating, but you're still interacting with vegetables. So those can be very important. Cooking is another great way to get kids interested and interacting with vegetables. Many times these evidence-based approaches, though, must be preceded by feeding behavior therapy to really increase the acceptance of the food and the feeding practices. So oftentimes when we have someone who is very restricted with their eating, we do want to engage a feeding team to really work with the individuals to desensitize them to the foods that they have the aversions to and really increase the potential for a varied diet and really find sort of pleasure in eating, which will lead to ultimately a successful eater. The process can be very long, but small steps lead to major changes, which leads to an overall lifetime much healthier than an individual who's very restrictive. So what do we do if we suspect there could be an underlying medical issue with the individuals we're working with? We want to make sure that you're utilizing the Center of Excellence referral tools to help identify these medical issues. The screening forms are available for general medical concerns, for sleep disorder, for GI issues, for physical fitness and motor skills, as well as nutrition and feeding. And what's important to remember is that frontline staff and families, those individuals that are most familiar with the individual you're working with, if you suspect that a person could have an underlying medical issue, you want to make sure to say something. You want to follow your agency's protocol for medical support. If you're in a residential setting, if you're in a home setting, you want to contact primary care to discuss. It's often very helpful to be documenting signs and symptoms which may not be typical or expressed verbally. It's important to observe and report and make sure that you're talking to somebody in the moment. We don't want to wait and say, 2 weeks ago I noticed something. You want to report it as soon as you're seeing it so that we can make sure we get individuals the help they need quickly. So observe, report now. So in summary, it's important to keep in mind medical problems in people with autism are frequently not recognized. Medical problems in people with autism can cause or contribute to challenging behaviors, and issues may be difficult to identify because the individual has limited communication skills. So back to our true and false, way from the beginning. Number 1, individuals with ASD have common co-occurring medical issues. This, of course, is true. Individuals with ASD often exhibit behaviors due to other medical issues. Hopefully by now you know this is, of course, true. Medical issues are easy to identify in individuals with ASD. We know this is not true, especially for individuals who are nonverbal. And lastly, the most common co-occurring medical conditions in ASD are sleep disorder, seizure, gastrointestinal issues, and overweight and obesity. And we definitely know that to be true. Thank you so much for your time and attention. Hopefully this has you thinking about the individuals that you work with in a different way. Hopefully this opens your eyes to some medical conditions that could potentially be going on and contributing to behaviors that you're seeing. And above all, please make sure you observe and report now. If you have any questions, you can contact us at the training department at training@tcfd.org.